Hey guys, welcome to Hughes History. We're going to see if we can't wrap our hands around the American Health Care Act as it's proposed in the House of Representatives right now. We're going to do a little bit of the Johnny Cash and walk the line on health care as we go giddy up for the learned and go get her done right now. So before we get into the details, let's develop a little bit of context, because context is really, really important. And we're assuming that you know the basics about Obamacare, because if you don't, you're not going to understand anything that I'm talking about. So luckily for you, we already have a video that you can watch. But the American Health Care Act is meant to replace Obamacare. And ever since Obamacare was passed, Republicans have been voting to get rid of it. They did that 50 times, so now they have a chance to replace it. Now, you might hear it being called Trumpcare or Ryan Care, but this is the general plan for replacing Obamacare. So number one, you get to keep some good stuff. Everybody loves good stuff, except for the insurance companies. They don't like good stuff. But the good stuff is if you have pre-existing conditions, you're not going to have discrimination against you. You're going to be able to get a policy. If you're a blood-sucking leech on your parents, you get to do that as you do under Obamacare, up to the age of 26. And finally, insurance companies can't have any kinds of annual or lifetime caps. That was developed under Obamacare as well. So all of those three groovy, great things are going to stick around for Ryan Care, Trump Care, the American Health Care Act. Now, number two is also not so good for the insurance companies, and that's the individual mandate. Now, the Republicans have really been kind of presenting this under an ideological argument, a very powerful one, that the government shouldn't have to make you do something you don't want to do, like buy insurance. If you understand why it was done, the idea was that putting these healthy people into the insurance pool was good for insurance companies, and that would lower costs for everybody. But unfortunately, not enough young people got into the pool, so the projections on lower premiums have not come true. And for some people that are in kind of this cliff of where you're not getting subsidies, you're making too much, they've seen their premiums go up sometimes 200, 300, 400%. But there is no more individual mandate, which means young people now can opt out of the system. They don't have to have health insurance, so they're not going to be in that pool, and the government's not going to tax them or charge them anything for doing that. So yay for liberty! No more individual mandate. Now, we're going to talk about the subsidies and the tax credits in a minute, but subsidies and tax credits cost a lot of money. Someone's got to pay. Who's going to pay? Rich guy's going to pay. Not under the American Health Care Act. And again, this is an ideological argument that Republicans believe this is your money, and we shouldn't be taking your money if it's not necessarily benefiting you. So the taxes under Obamacare were a 3.8% tax on income from investment, a 0.9% tax on income for those making $200,000 and more. And there was also a Medicare surcharge tax on the wealthy as well. So all of that tax revenue that was coming in from these wealthy people is not going to be coming in anymore. But that's the idea, that this is their money and we shouldn't be taxing rich people for a government program. But that's number three, cutting taxes for the rich. So one aspect of Obamacare was that you could join with no penalty. You could just not have insurance and go get insurance. So part of the American Health Care Act is this concept of continuous coverage, which means that if you drop coverage, they're going to give you a short window, 63 days, in order to get a new insurance policy, and you're not going to pay a penalty. But after that 63 days, if you do want a policy, if you've let that coverage lapse, you're going to pay a 30% surcharge. So if your policy is $10,000, you're going to pay an extra $3,000 to get insurance. And the fear is that only the sick will do this, because who would do it if you were healthy? Why would you pay that large amount? So the fear is that you're going to keep these healthy people from joining the pool, which is going to cause premiums to rise. But of course, the idea behind it for the insurance companies is they don't want people just waiting until they get sick and then getting insurance. There needs to be a penalty for that, so they're not just paying paying these high costs out for people jumping on the gravy train. So number 5 is getting rid of the subsidies. And the way that Obamacare worked was that if you didn't make that much money, if you were below $75,000, the government was going to provide you subsidies in order to make that insurance affordable. That was paid by those taxes we just got rid of. So if you were, say, making $26,000, $27,000 a year, that subsidy would go to you no matter whether you were 21 or you were 64 years old, and that would basically mean you would pay about $1,700 for insurance. So the Republicans have changed that, and they're now going to a tax credit system that is based on age and not income. So this would affect people in different ways. But right now, if you're an Obamacare recipient, we have to remember that most people still have employer-based insurance. So we might be talking about their premiums, but we're not talking about these tax credits and these subsidies, because their insurance goes through their employer. We're talking about a much smaller percentage of people that have to go out and buy their own insurance on the open market. And the overall argument is that the free market will drive down costs, which are going to make things more affordable, so you can own your own insurance. That's your own life decision. But let's go back to that example. So if you're making $26,000, the worst case scenario is you're 64 years old, because that means you're not eligible for Medicare, you're not in Medicaid, so you have to buy your own insurance. So under Obamacare, you were going to pay $1,700. We should get a drum roll for this one. Under the American Health Care Act, you're going to pay $14,000 for insurance. That is, unless those premiums go down rapidly. Now, if you're 21, you're actually going to pay less for insurance, because this isn't income-based, this is age-based. So that'll be a big difference for some Americans who are going to lose those subsidies and instead are going to have to rely on kind of paying out of pocket and then receiving that money back as a tax credit at the end of the year. And it works kind of the same way in terms of the income. If you make less than $75,000 or as a family $150,000, you're going to qualify for these tax credits under Trumpcare. It's Ryan Care, it's Trumpcare. So another biggie is going to be the ending of the Medicaid expansion in 2020. And if you watch the Obamacare video, you know that Medicaid was expanded by the federal government paying for people that were at 138% of the poverty level. So this affected a large amount of the working poor who weren't qualifying for Medicaid before Obamacare and now are receiving Medicaid, including mental and drug care. So that's a huge deal for a lot of people. But Republicans believe that this is a state issue, that the state should be responsible for their own citizens. So there were calls for block grants, just giving the states a big block of money and letting them figure it out. But right now the concept is to keep the Medicaid expansion going for another 4 years and then to turn that back over to the states so they can decide what they want to do. Whether they can afford that or not is going to be up to them after 2020. So that would be the ending of the Medicaid expansion. So for number 7, we need something for the insurance companies. They need to charge people more money to make up that money they're losing from the individual mandate from having those healthy people. And there was a premium age rule under Obamacare that the insurance companies couldn't charge older people more than 3 times the amount they charged younger people. So there's a slight change in that rule under Trumpcare, and that's now going to be 5 times rather than 3 times. So if I'm charging a young person $5,000, now I can charge that elderly person, or up to 64, up to, let me do the math, oh my goodness, $25,000. I think that was a game show. There's also going to be a change and an investment into what's called health saving accounts. And this existed under Obamacare, but it basically allowed you to kind of shelve away about $3,500 for the year, and that was tax exempt. Republicans really believe in this concept because the idea is you're owning your own health insurance. So now that's going to be tax exempt up to $6,500. Now, as we get into the pros and cons, I think it's important to understand that it really depends on what you're arguing for. If you're arguing for the concept of a progressive position and you believe in universal health care, you're going to be sad by this plan. But if you're more of a liberty type of person, that you believe that's an individual liberty thing, you're responsible for your own health care, then you're probably going to like this plan. But in terms of the pure numbers, there's good news and bad news for both sides. Now, the bad news is there's going to be less people covered. Now, the CBO, the Congressional Budget Office, makes forecasts. They're not always really great at it, but we need some kind of guideline, I guess. It's going to estimate that while Obamacare increased the rolls by 23 million people, now about 6 million people lost health insurance, but that means 17 million people gained health insurance. So the CBO estimates that 14 million people would lose their insurance next year, and by 2020 that number would go up to about 21 million. But as Republicans have argued on the other side, that some of that's due to the individual mandate. You're not making people buy insurance, and that it should be up to you yourself. If you want insurance, go out and get insurance. Now, good news for the deficit is we're going to reduce the deficit over 10 years for about $337 billion. And for the most part, that's due to stopping the expansion of Medicaid. We're not going to be paying that money out for these Medicaid recipients, so we're going to save a lot of money. And that's offsetting even the tax cuts because there's less revenue coming in. There's also good news in terms of the premium forecasts. Now, all forecasts show premiums going up. Most insurance policies went up at the rate we expected to do under Obamacare, but some policies went up a lot faster. But there is this projection that premiums will continue to rise to about 2020, but then eventually market forces will start to drive down those costs about 10% for most Americans. Now, there's also a lot of other stuff we're not talking about. Some of the Medicaid problems have ripple effects. So if people aren't going to be on Medicaid, the CBO goes into forecasts that you're going to have more unwanted births because people aren't going to preventive care or Planned Parenthood, those sorts of things, which is going to cost more money in the long term. And one of the more dire forecasts is because less people are going to have insurance, you might have more deaths, which means Social Security is going to save money because we're not going to have as a high life expectancy. Good news. Now, we have to keep in mind this video was made before they even voted on the sucker, and there is a lot of contention about whether or not it has enough votes to pass. In the House, the concept is that the Freedom Caucus and conservatives are kind of upset that this doesn't go far enough to get rid of Obamacare. And in the Senate, the problem is that you have moderates in swing states, Republican senators, that think this goes too far, and that by cutting Medicaid off, that's going to be a bad thing, and they're not going to get reelected. So what do you guys think? I think this is probably as much about ideology as it is about numbers, but we certainly want to read your comments down below where you're going to keep it civil because you're an American. Or maybe you're not. Maybe you're from a foreign country and you want to chip in your view as well. That's great. So make sure that you haven't subscribed to Hip Use History. You do that right now. We have over 430 videos and we're putting them out all the time. I'm just spitting them out, one after the other. Make sure you subscribe. And always remember, because I say it at the end of every lecture, because I mean it with all my heart, where attention goes, energy flows. We'll see you guys next time. You press my buttons.